Doctors, under the aegis of the National Association of Resident Doctors, last week suspended their 2-week warning strike over a range of issues. The major bone of contention is a demand from the federal government to pay a hazard allowance to doctors and other healthcare workers fighting on the front lines of the COVID-19 war. The doctors appear to have left their fate in the hands of the Nigerian Governors Forum. But at the same time, they have served another warning of the resumption of the industrial action in another 4 weeks in the event of the failure to meet their demands. Joining us now to take a look at all the issues involved here is Dr. Itohan Oaku, President, Association of Resident Doctors, Lagos State University Teaching Hospital. Good morning, Dr. Oaku, and welcome to the program.
Good morning.
Good morning.
Thank you for having me here again.
Good morning. Thank you very much. Well, just to set the tone for our conversation, we would like to walk us through the demands of the Association of Resident Doctors, who constitute about 40% of the total number of doctors in Nigeria. What exactly are the demands, and what kind of response have you been getting from the federal government?
So I will just go straight right into the question. So part of our demands and that which have been responded to by the federal government included provision of personal protection equipment to some hospitals. In this era of COVID-19, there were some hospitals who were not being provided the necessary apparatus, and that was actually one of the demands that we had. And as it is now, we are aware that some of these hospitals have gotten these PPEs. And though these are consumables, I would appreciate that they are renewed, the supply is sustained. Also, we asked for the Medical Residency Training Act to be domesticated in the state tertiary health institution, as well as implemented in the federal health tertiary institutions. So as it is now, the Medical Residency Training Act has been included in the revised 2020 budget at the federal level. However, it still needs to be implemented. It still needs to be domesticated in the state tertiary health institutions. So as it is, it's still at the promissory level. And also, we had issues with salary shortfalls for some of our doctors all over the nation. Well, we've been promised by the government of the Federation that that will be looked into. Also, commitment to procure group life insurance for healthcare workers. All right, government has shown some commitment, and we are hoping that it will realize. We will see that, materialize. Then also part of the demands included reinstating some illegal disengagement of some resident doctors at JUS, that's Jos University Teaching Hospital. And as at now, these 26 doctors have been reinstated. We are happy about that. And the chief medical director has been directed to pay their withheld salaries and comply with the provision of the Medical Residency Training Act. However, on the state tertiary health institution issues, their issues are still pending. All right, so we have that, as well as the COVID-19 allowance. The COVID-19 allowance, you have already mentioned that the hazard inducement allowance is being paid to some centers. Not all of the centers have received theirs, but at least we are seeing the commitment of the government towards that. But like I said, for the state tertiary health institutions, the demands are still unmet, and they are unique to each state. I'm from Lagos. We have our unique needs that are still unmet. We've been able to meet with the head of service during the period of the strike, and it's still more of promises and promises, I must say.
Thank you for that update, Doctor. It was reported that the federal government has released 4.5 billion naira to 31 federal teaching hospitals and 9 billion naira for group life insurance. Can you confirm that?
Yes, they have told us this. As it stands now, I'm aware that we have about 16 of these federal tertiary health institutions that have received this hazard allowance, COVID-19 hazard inducement allowance. So we are expecting others to give us feedback, So truly, I believe they've paid these monies, and the respective government and CM, the chief medical directors of these hospitals, I'm sure, would also attest to that. But of course, it's not reflecting in some of the hospitals yet. So that's all I can say for that.
I mean, there have been protests about, or grievances about, even the way this hazard allowance is being paid. Some cadres are getting more while the others are not getting as much as they should get. I mean, what's it like? Can you just tell us what process goes on as regards this hazard allowance, one? And secondly, let's talk about the trust that most of the resident doctors have put in the Governor's Forum. Do you think that will not be put to test very soon? What if the Governor's Forum does not get a very good deal with the federal government as regards the trust you've put in them?
Okay. With regards to the percentage of the COVID-19 hazard allowance, it actually depends on the exposure of medical personnel to hazards, as it were. And this decision really was not taken by just the doctors. It was a group of medical professionals. You had the joint, that's the JUHESU Health Union, comprising of the laboratory scientists, the nurses were involved, the other parastatals in the medical field, as well as non-medical staff working in the hospital. So it was everybody, different unions that came together to arrive at these percentages that we have. So based on exposures, to hazard, essentially, this cut was arrived at. And I must say that this is actually a revised memorandum of understanding between the federal government and these healthcare workers. Why? Because the initial agreement, government eventually confessed, heeded to the fact that they couldn't, carry out that promise. And so there had to be some revision to that. And so that was how those percentages came about. And then with respect to trust, I must say that we are really putting ourselves on the line here, because trust ab initio was, the lack of trust ab initio was the main reason why we even embarked on the strike in the first instance. But like we say, hope is, is something that we cannot remove from the equation totally. We just keep hoping, we keep hoping that things will change. And since we've NAD representative met with the chairman of the Nigeria Government Forum, Dr. Fayemi, His Excellency Governor of Ekiti State, and he assured us and promised us, he made an appeal. And based on his appeal, the fact that we get to see someone, at the state level, we're able to meet with the number one, person, as it were, the state level, and he made an appeal that we call off the strike and that something tangible will be done. We do not want to be seen as people, because truly we are not strike mongers, I must tell you. We understand the peculiarity of our profession and the fact that patients are involved, and they are the ones at the end of the day that would suffer the most. So based on all of this, we had to, call a truce and suspend the strike. We are giving 4 weeks to be able to see some realistic, at least give some realistic goal point, to allow for realistic implementation of promises that have been made. So, well, we are going on a limb here. We are really going all out, and we hope that this trust will not be breached at the end of the day.
Well, Dr. Oaku, we'll take a short break now. When we return, the conversation will continue. Please stay with us. We'll be right back after this commercial break. Welcome back to the Morning Show here on Arise News. Still with us is Dr. Itohan Oaku, President, Association of Resident Doctors, Lagos State University Teaching Hospital. Well, Dr. Oaku, thank you very much for staying with us. But I would like to ask you a question now, and I would like you to respond not as an activist, not as a unionist, but as a stakeholder and a citizen. What's your assessment of how Nigeria has managed the COVID-19 pandemic so far? Are there things we need to correct? Are there things we're doing right that we need to sustain? And we also understand that over 800 health workers have been infected with COVID-19 in the course of their work. Beyond hazard allowance, PPE, I mean, does an association like yours need to also worry about training for your members and for other health workers?
Okay, thank you very much. If I may start from the last question, going upwards. Well, in LASUTH, the Association of Resident Doctors, we have amongst us, we constituted a group, or you could call it a task force, which we called ARD COVID-19 Response Team. And what this team is meant to do is to ensure available personal protective equipment are enough for the doctors, and that not only that, we also ensure trainings. We carry out virtual trainings for ourselves, for the community here in LASUTH. So we've had trainings on putting on the personal protective equipment appropriately. We've had trainings on donning off. We've also talked about the way forward, subsequently in the post-COVID-19 era. So these are things we are doing amongst ourselves. We are ensuring we are even going all out to procure PPEs for our members. And I think this little we are able to do in LASUTH ARD. Now, as a whole for a state, I would say that so far, we have tried, and to be honest, the government has tried. They've put in measures. They've tried to ensure that individuals are tested. They've tried to follow through, not just testing them, but also to track, exposed members to be able to curtail the spread as much as possible. But really, I think the job is overwhelming. We have just 3 centers within Lagos where COVID-19 is being screened. Well, the test is being carried out. Well, not being carried out as it were. We have several spots in Lagos, the local government areas. You can go in, you can get screened, but the actual testing, the actual screening process is just in 3 centers in Lagos. So we have issues of results not coming out early. So you find that samples are collected, but no results in 1 week. That is minimum. Sometimes 2 weeks, sometimes not at all. You don't get to see your results. So it's quite overwhelming for these centers. Like we all know, Lagos is an epicenter of the COVID-19. 3 centers alone having to carry out this test to screen for this COVID-19 virus is actually way suboptimal. I think we'll need, what I would advise, we need more, screening centers. The 3 is not enough, and that is one aspect, the issue of results not coming out when they should, because at the end of the day, you are not able to identify who is positive. At the end of the day, the person who is positive ends up, mixing with the crowd. And of course, the infection spreads. So it's really making it difficult to curtail this infection. Another thing, that, apart from this delay in getting results, is the fact that the hospital beds, they are being overwhelmed. Okay, even when we get positive patients, there are no more spaces to admit, cases that need to be admitted. So now we are telling ourselves that, okay, fine, you may be positive. If you are asymptomatic, you can self-isolate at home if you have that, a place to do so. Otherwise, you can come over and we'll find a means of self-isolating the individual. So there are issues on ground that still needs to be looked at, and to be able to curtail this spread, okay, like we said, prompt, testing and release of results will go a long way in curtailing this. I believe if we can work on that, it will really help us a lot. And of course, we can't overemphasize the availability of personal protective equipment, because right now we've gone beyond community transmission. We are now in the era of hospital transmission. So if within the hospital we can't protect ourselves, apart from exposing each other, even the patients that come in who were negative can also be exposed, having it from the doctors. So we don't want that, and we want that minimized as much as possible.
Thank you, Doctor. I'm looking at a headline from today's This Day newspaper. COVID-19, federal government seeks to criminalize non-wearing of face masks. Can you take us through once again for the cheap seats? Because some people seem to have no idea of the necessity of face masks. Tell us exactly why it is so important to the individual, to their families, and to people like yourselves, talking about the need for PPE curtailment, how we all endanger people like you on the front lines when we refuse to wear our face mask.
Yeah, thank you very much. So wearing a face mask, very, very important, I must say. May not be as important as washing of your hands and hand sanitizer, but very, very needed now that we are being asked to move around, now that we are being asked to, socialize a bit. Why is it important? Now, the virus itself is a respiratory infective one, and we find that anyone who talks, coughs, even laugh, shout, sing, as long as the mouth is opened, the tendency for anyone infected with the virus, the tendency for the virus to, spread is there. And so the face mask is meant to restrict and prevent as much as possible these showers of viral particles from an infected individual. Now, the face mask, if I put on a face mask and I'm speaking with someone who doesn't wear a face mask, as much as possible, I'm not only protecting myself, but I'm also protecting the other person. Assuming that I have the infection, I cover, I will minimize the spread while talking or laughing. I will minimize the spread, with the individual there. So me putting on a face mask will not just prevent whoever is talking, from giving me the virus, but would as much as, if not double, protect the other person. Okay, because in me talking, I'm also preventing the viral particles from being spread. So please, it's very important that we put on our face mask when we go out. Okay, it's very, very essential, as it helps to curtail the spread. I know there have been issues on how efficient the face masks, the types of face mask, being used, and if it really has any say as such. Different articles have come out. Some have debunked, especially for the cloth face masks, I must say. Some have debunked the fact that it has any, value as such, while others says, oh, it does have. But I would say, give or take, it is better to put on that cloth face mask, in the public. We can't all be putting on surgical face mask. We can't all be putting on N95 face mask, but the minimum for the general public is the cloth face mask, and is needed to prevent transmission.
Well, thank you very much, Dr. Oaku, for joining us this morning on The Morning Show.